Okay, good morning, student, once again. So today we will be discussing about this shock. That is the continuation of whatever we have discussed on the last class. So let us have a brief like revisions on whatever we have discussed on the last class so that we can continue. Okay. Can you see the slide? Is it visible?
Yes, ma'am.
Okay. Okay, so on my last class, I have taught you all about the shock. No? So in your syllabus, you have about the causes, right? And causes as well as types of shocks, I guess. So that day we have discussed about the definitions. That is about the shock, which was a critical conditions which happen when there is a sudden drop in our blood flow. Nah? So it may, this condition, that is sudden drop in the blood flow, it may result because of trauma, because of heat stroke, because of blood loss, because of some allergic reaction, because of some severe infection, because of poisoning or any kind of severe burn. Okay, these were some of the results or some of the causes that can lead to sudden drop in the blood flow. So that was a brief introduction we have discussed on the last class. And the shock, it is a, we know that shock is a life-threatening diseases. It's not it is a life-threatening diseases. So if immediate treatment is not given, then what happens is that like a person can eventually lead to death. So the disease is very, very much severe. And then like emergency treatment, whenever like you find shock, then emergency treatment is needed. Okay, and then many organs can also be damaged, and once the organ is permanently damaged, then it can lead to death. So that was the introduction part that we have discussed on the last class. Are you still clear even in today's class what we have discussed on the last class? Yes or no?
Clear, ma'am.
Okay,
Yes,
okay.
ma'am.
Respond first. Okay, next we were discussing about the causes of shocks ना, क्या का वजह से like shock होता है, क्या reason का वजह से, what are the causes? Okay, so let us see, revise. That is hypovolemic shock. From the name itself, volume, it indicates fluid. So from the name itself, you can know that if there is excessive loss of blood, or if there is excessive fluid loss, okay, and that fluid loss, if there is a loss of blood, and if it exceeds more than, who is that? Please don't disturb the class. Please mute yourself. Okay, so if the blood loss exceeds 1.2 liter, okay, 1.2 liter, then what happens is that can lead to shock. And then, okay, and that particular blood loss, it can be due to external or else internal bleeding. So that was about the hypovolemic shock. And then there are certain, apart from the blood loss, there are other certain body fluid also which we possess. Okay, when we sweat also the blood is lost, right? When means the fluid is lost now when you sweat. And when you have excessive loose motion, that is diarrhea, and जब burn होता है तब भी बहुत सारा fluid loss होता है ना. So these are the conditions where the fluid loss can be seen in an individual or in a person. So when the excessive fluid loss, when it occurs, that is more than 1.2 liter, then we call it as hypovolemic shock. Are you clear, all of you, once again?
Yes,
ma'am.
Okay,
Yes,
next cardiogenic shock. So cardiogenic shock, from the name itself, cardio, it's related to heart. So cardiogenic shock, heart. ये cardiogenic shock ये क्यों होता है? It occurs when an adequate volume of blood is available. Means शरीर पे enough blood available होता है, adequate volume of blood available होता है. लेकिन हमारा ये heart है ना, ये means heart blood को pump करता है ना, तो ये heart अच्छी तरह blood को pump नहीं कर पाती. क्यों नहीं कर पाती? Because of certain heart diseases. So maybe because of heart attack, maybe because of acute heart failure. So many kinds of heart diseases are there. Okay, So it's uncountable heart disease. So heart disease होने का वजह से, heart में disease होने का वजह से अच्छी तरह pump नहीं होता. Means like, let me explain again in English. When we have enough volume of blood in our body, but as there is some infection or there's some disease occurs in our heart, due to that our heart is not like our heart does not possess enough capability to pump the blood. Okay, that is why it led to, because of that reason, it led to cardiogenic shock. It led to shock, which we know as cardiogenic shock. Are you clear, all of you?
Yes, ma'am.
Yes, ma'am.
Okay, done. Next, other types of shock. So there are some other causes of shock which include shock that occur because of infection. Infection का वजह से भी shock हो सकता है ना? तो उस shock का नाम था septic shock. I'm repeating again, septic shock. Septic shock, septic नाम itself is infection है. इस septic हो गया ऐसा बोलने से infection. And then lack of certain hormones, low blood sugar level. So अगर शरीर पे sugar level कम हुआ, if there is a less sugar level in our body, which we call it as hypoglycemia. Okay, तो अगर शरीर पे अगर certain hormones कम हुआ या फिर blood sugar level कम हुआ, then there occurs a shock. Okay, and the name of that shock is known as metabolic shock. And then again, there is when a person feel cold. Okay, when a person drop the temperature. Okay, when he or she drop the temperature, that is hypothermia. And if there is any injury occur in the respiratory tract or lungs, then there occur a shock which is known as respiratory shock. So I hope you are clear once again. And then the most important, that is anaphylactic shock. This is the shock that occurs due to allergic reaction. कुछ allergic reaction शरीर पे बहुत होता है ना, अगर excessive हो जाने से क्या होता है, it can lead to shock, and the name of that shock is known as anaphylactic shock. And when intake of overdose drugs, certain medication are there, na, if you take overdose, and then if there is injury in your spinal cord, then that can lead to a shock which is known as neurogenic shock. So are you clear about the causes of shock? This is very much important. Not only the name, but about a brief definition of this will come in your final as well as in your this one in your exam. Okay, in your whatever exam is going to come. Are you clear,
Yes,
all of
ma'am.
you?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, that was just a little bit of revision. Okay, let's move on. So these are the symptoms. I'll just read like this because we already discussed ना. What are the symptoms? क्या symptoms दिखाई देगा? अभी तो हम लोगों ने उसका definition पढ़ा. We already studied the definition. After that, we have studied that what will cause shock, the types of all those we have discussed. After that, if someone suffers from shock, then what will be the symptoms, that what will be the like physical changes that can be seen in a person. Okay, so uska pulse rapid hoga. Initially there will be a rapid pulse, there will be pale look, face sharir pura pale hoga. Okay, it won't look like it won't look normal, it will look pale. And then cool, calmish, sweaty skin. So obviously we have seen now that there will be excessive fluid loss or blood loss. So हम जब sweat करते हैं तो बहुत सारा fluid loss होता है ना, तो you will see that kind of symptoms also you will see in a person. अगर कोई shock में है तो उसको अगर बाहर से देखने से उसका शरीर पूरा like sweat होगा. Okay, like in some person, not in everyone, sweat होगा. So that indicate that excessive amount of fluid is lost in his externally, okay, from his body. So that are the symptoms. As shock develop, rapid shallow breathing भी कभी-कभी fast होगा, कभी-कभी shallow होगा, or cold clammy skin, same thing. Rapid weak pulse होगा, dizziness or fainting. Dizziness माने चक्कर आएगा ना, चक्कर आएगा, तो dizziness or fainting. And weakness. Okay, weakness means, okay, obviously when you have some diseases in your body, obviously you will feel weak, na? You won't feel active. So the eyes appear to stare. Shock hone se, like when we see one object, we keep on staring that particular object. It's not it. So especially when we look some movie, interesting movie, we keep on staring that particular movie. Na? If some coffee is provided in front of us, also like we just like ignore, we forgot, because with whatever we are looking, we are so much concentrating. So that is how the shock patients' eyes look like. They keep on staring in the one particular object or things. And then the other one is anxiety or agitation, means they get anxiety very easily and they get irritated very easily, and they get angry very easily. And then seizure. Seizure means that they, what was the other name of seizure, which I have given you all in my last class? Seizure. Arey, that day I have given you all na, uska dusra naam. Don't tell me you don't know. What is the other name of seizure? I am not audible, or else you all are quiet. What is the other name of seizure? What is the other name of seizure? Anyone? Carly, what is the other name of seizure?
Contraction in body, ma'am. Rapid
No,
contraction.
the other name, not the meaning. Other name, other name. Like when we call bleeding, the other name of bleeding is hemorrhage, right? So what is the other name of
Yes.
seizure?
I
have
forgot, ma'am.
anyone? Oh God, Jiban, what is the other name? You all were sleeping or what in my class, in my last class? What was the other name of seizure? Jiban? Manas, what is the other name of seizure?
Ma'am, can you repeat?
Okay, Jiban, what is the other name of seizure?
Ma'am, convulsion.
Yeah, very good. Carly, the other name of seizure is convulsion. Don't forget, okay?
Yes, ma'am.
Yes, convulsion. Because in exam, I might give you all in fill in the blank. What is the meaning of convulsion? And that time, don't say that, oh, we got seizure, but we did not get convulsion. We convulsion from where this word came. Don't act like that, okay? Because in Viva also, I might ask you all what is convulsion. And I might ask you all to do the like demo of this. So what is the meaning of a seizure? It is a normal body movement, right? Right or wrong?
Wrong, ma'am.
Then what is the answer?
Irregular movement, ma'am.
Yeah, irregular or abnormal body movement. It's not it. Abnormal shaking or any part of your body. So that we call it a seizure. So don't forget this. Okay, moving on to the next. These are the symptoms you will get in shock. किसी का शॉक होने से ये सब दिखाई देगा शरीर पे. So when you see all these symptoms, don't get shocked. You say that, oh, all these things, so I have already studied. Okay, in my diploma, during my diploma, I have already studied all these things. So it's very, very normal for me to observe the shock patient like this. So just keep in your mind all these things. So a person will have confusion, unresponsiveness, response nahi dega means unresponsive hoga. All these things. Not in every person, but in some cases. There will be low or no urine output. The person might pass urine or might not even pass urine. Or the urine output will be very less or no urine output at all. There will be bluish lips and fingernails. The fingernails will be bluish in color. The lips will be bluish. Obviously, when we have like when someone is having anemia, that means like low level of blood. Okay, low level of blood anemia means low level of RBC in the blood. Okay, at the time what happens is that sharir pura pale ho jata hai. Lips and all used to become bluish. The fingernails used to be bluish. All those things. This is how you can observe that there is some lack of blood in his or her body. So that is the other symptoms. And then sweating, very common. Nausea and vomiting might occur. Nausea and vomiting is not the it's not the first thing. Okay, it's not the first outcome. It is it might occur. It is mentioned. So the casualty might feel thirsty. Obviously, when you sweat too much, when you lost too much of fluid, then you will obviously feel thirsty. So these are very, very common symptoms. And the other one is the casualty might become restless and aggressive. Okay, obviously, restless hoga, aggressive hoga. And then the casualty might complain of chest pain. He might complain of chest pain in some cases. So these were all the definition about the causes, okay, and about the sign and symptoms which we have discussed in the last class. So are you clear more today?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So now let us see if someone has shock, what we need to do, what to do. First of all, we have to reassure the casualty, okay? We have to reassure the casualty when conscious. So you have to, this is always the first primary thing that you always need to do. You have to reassure the casualty, like you have to keep the casualty in a safety place, and you have to reassure that like nothing worse gonna happen, like you'll be okay, like reassurance you have to give. You have to accompany him, okay? And then the other one is treat the possible cause of shock that you can detect, such as a severe bleeding. So shock might occur because of severe bleeding now, which we have already discussed in the causes. So severe bleeding hone se kya hai? Agar if the first 8 boxes in front of you, so we have discussed in the bleeding na, in the hemorrhage, agar bleeding hua to kaisa usko stop karna hai. So what was the point that I have taught you all when someone have excessive or severe bleeding, how you need to prevent or stop? I have already taught you all in the hemorrhage bleeding. Because the second point is treat the possible cause of shock that you can detect, such as severe bleeding. So how say? Carly, can you please explain? Someone is having shock, okay? And then the reason behind his condition is because of severe bleeding. So what remedies or what step you would like to take? Means what precaution you will follow?
First of all, we will find the if the bleeding is external or internal.
Yeah.
If it is external, we will try to stop the bleeding by placing bandage, gauze, etc.
And then what we mainly used to do to stop the bleeding, we press something.
Yes, ma'am. Press gauze on the affected area, ma'am.
Yes, we have to give the pressure. You have to apply the pressure, right?
Yes, ma'am.
Okay, very good. Okay, that is what you need to do if the bleeding occur. If the bleeding is the reason behind the shock, then you have to do, because ये सब तो हम खुद कर सकता है ना externally, तो like we can at least do this primary treatment. Okay. Next, lay the casualty comfortably on his back on a blanket. However, in cases of injury of the head, chest, or of the abdomen, lower the head slightly and turn it to a side. In case of vomiting, put the casualty in the recovery position. So, first of all, what we need to do is that we have to lay the casualty comfortability on his back on a blanket. Okay, so we have to carry the casualty and then lay him down comfortably on his back, and if blanket is available, or if any kind of soft blanket is available or whatever it is, you have to apply on his back, okay, so that he feel comfortable. So that is the step you need to do. And however, in cases of injury of the head, if the casualty is having injury on his head or on his chest or on his abdomen, so at that time what you need to do is that you have to lower the head slightly, okay, lower the head slightly, and as well as you have to turn it to a side. Okay, so don't forget this. If there is the cases of injury of the head, chest, and the abdomen, instead of like putting the head forward, okay, you have to lower the head slowly and turn it to a side. And then if there is a cases of vomiting, we have to put the casualty in the recovery positions. So you know what is recovery position? Anyone? Recovery position? What is recovery position? Anyone? Recovery?
When a person get recovered from a disease or
No. I'm asking when someone is in someone cases is vomiting. Okay, if someone is vomiting, you have to put the casualty in the recovery position, right? So recovery position kya hai? Anyone? What is recovery position?
Laying on the back, ma'am.
Yeah, you just need to lay down, okay, in the lateral side. We call it as lateral recumbent. So just in the lateral side, जैसे normally हम लोग जब बिस्ना पे lay down करते हैं ना, normally sidewise, side में ऐसे lay down करना है. So that is known as recovery position, or you can call it as lateral recumbent. Okay, and that is how recovery position looks like. Are you clear, all of you?
Yes, ma'am.
Okay. Okay, next. You may raise and support the leg. However, do not do this when you suspect a fracture or spinal injury. So what happens is that when there is some injury in the leg, or when there is some problem, okay, or some defect in the leg, so sometimes we might raise and support the leg. It's not it. Agar bleeding bhi hua ya kuch bhi ya hua, so in order to relieve the pain, or in order to treat the pain, okay, we sometimes need to raise the leg or support the leg, okay, in case of injury. But if there is a symptoms, or if there is a if suspicion of a fracture, okay, in that particular bones of the leg, or if there is any spinal injury, then we should never raise up or support the leg, okay, in case of fracture or spinal injury. That is the difference. Okay, पैर तो like raise up करना है, okay, लेकिन अगर fracture या फिर spinal injury suspect किया तो never raise and support the leg. Okay.
Yes, ma'am.
Okay. These are very, very simple things, but we don't used to know now all these things. We never even apply also. Like loosen the tight clothing, because if there is any tight cloth, okay, if there is any tight cloth, try to loosen the cloth. And then keep the injured person warm by taking off wet clothing, cover him with a blanket or other covering, taking care not to overheat him. So keep the injured person warm by taking off wet cloth. Why do we need to do this? I have taught you all there was some shock that occur when you have something. Just before we have revision on that. We have to keep the injured person warm, right? How? By taking off wet clothing. Why we need to perform this?
Hypothermia, ma'am. Hypothermia.
Very good. Because a person may have hypothermia, right? So, वो क्या shock था वो? What was the name of that shock? Don't tell me you don't know.
Respiratory shock, ma'am.
What?
Respiratory shock, ma'am.
Respiratory shock. Okay. Is it correct? Are you sure?
Yes, ma'am.
Okay. What about other are why always silent? Trying to be silent killer or what?
Undercooling.
Silent whenever I ask something. Okay. Okay, when there was undercooling, that is hypothermia or injury to the respiratory tract or lungs, whatever, it can also lead to shock, right? So hypothermia ko prevent karne ke liye, we should always keep the injured person warm, okay? Warm, and then we have to cover him with a blanket, or if any other articles are available, okay, apart from blanket, any other articles, any cloths are available, then we should try to cover with that materials that is available. And then we should also keep in mind, okay, or we should also take care not to overheat him. Means usko warm karna hai, lekin itna bhi jada heat nahi dena hai, because that too much overheat of the skin, okay, can cause burn. So that is, if it causes burn, then there was also another shock, right? What was that? Anyone?
Severe burn, ma'am.
Severe burn.
Hypovolemic shock, ma'am.
Hypovolemic
shock.
Hypovolemic shock. Okay, very good. because when we overheat someone, then that can cause burn ना. When there is a burn, अगर किसी का शरीर में burn हो जाने से क्या होगा, from there in burn it is not always that सिर्फ खून ही निकलेगा, it's not like that, because of all those food and all na, like all those yellow fluids and all, many kinds of body fluids are available na in our body, so all those fluid can also be drop out. So if excessive fluid of all those drop out, then what happened, that can also lead to shock, which we call it as hypovolumic shock. So prevention of all this overall in one time is very much essential. So are you clear with the 6 points that we have discussed, what you need to do when someone have any kind of like shock?
Yes, ma'am.
Okay. Let's move on. Next is the number 7 point. So, in case of major injury, nothing should be given by mouth, as he may later need an operation or blood transfusion. The general principle is never to give food or drink to a casualty. Important exceptions include hypothermia, that is low body temperature, like all these write down. Okay, if you want to like know it for like a further knowledge, then you can write it down. Hypothermia, that is low body temperature. I have just mentioned in the black bracket so that you all can know. And hypoglycemia. Okay, hypoglycemia means like low level of blood sugar, okay, in our body. So you can just write down hypoglycemia ka matlab. Do you know what is the meaning of hypo and hyper? Hypo and hyper.
Yes, ma'am.
Okay, hypo means low and hyper means high. So hypothermia, you know, then you obviously, if I ask you what is hyperthermia, you will know. If you know hypoglycemia, you will also know what is hyperglycemia. So agar hyperglycemia होने से क्या disease हो सकता है? I'm not asking about shock. Hyperglycemia होने से क्या disease हो सकता है? Very common.
Diabetes, ma'am.
Is very good, because when there is excessive sugar level in someone's body, na, then that can lead to this diabetes. So in number 7 point, what we get to learn is that in case of major injury, okay, in case of major injury, if there is major injury, then we should not give anything by mouth, okay, or as he may later need an operation. So we should always be careful. अगर थोड़ा सा like major injury हुआ ना, तो कुछ भी मुख पे कुछ भी नहीं देना है, क्योंकि he may later need an operation or blood transfusion. क्योंकि blood transfusion का through से ही like it will suck out, it have to suck out all the things, or all the like what to tell, like all the debris that are present ना, that are all the debris that are present inside the mouth. नहीं निकल पाएगा ना, तो blood transfusion करके ही या फिर operation करके ही निकलना पड़ेगा अगर छोटा injury हुआ. So if there is injury in the mouth, and also never give anything to inhale or to swallow. And the general principle is never to give food or drink to a casualty. So during the shock, never ever give food or drink to casualty, okay, until and unless it is prescribed by the physician. Physician ka matlab doctor. Until and unless it is prescribed by the doctor, okay. And there is, but there is exceptional in some cases, okay. ऐसा नहीं है कि हर shock patient लोगों को food या फिर drink नहीं देना है, ऐसा नहीं है. There are some exceptional cases, okay. Those are hypothermia. अगर किसी का hypothermia हुआ means low body temperature हुआ, तब तो कुछ चाहिए होगा ना. तो in all these cases are exceptional. And next is hypoglycemic shock. If there is low blood sugar in a diabetes patient, that also like there should be some like fluid and all to increase the sugar level, na. So these are in these cases also there is exceptional. And in case of diarrhea and fever leading to dehydration, क्योंकि डायरिया का मतलब क्या है? डायरिया का मतलब
irregular bowel movement, ma'am.
Diarrhea, डायरिया डायरिया का मतलब है लूज या फिर वाटरी स्टूल। ओके, जो हमारा जो लेट्रिन है ना, जो स्टूल है वो लूज और वाटरी स्टूल होगा। ओके, बहुत वाटरी होगा तो उसको हम बोलते हैं डायरिया। सो दिस व्हेन डायरिया ओकर, जब हमारा स्टूल व्हेन वी passes through stool, when we have diarrhea means like we frequently go to the latrine to pass our stool na. So at that time that means lots and lots of amount of fluid are lost from our body when we have diarrhea. That means when we have loose motion. So this diarrhea occur maybe when someone have contaminated food na. So if someone have like contaminated food means like dirty food and all na, तो जब लेते हैं तो like that at that time वो होता है diarrhea होता है. So in these cases also it is exceptional. Okay, like ये सब cases में ऐसा नहीं है कि they don't need to be given food or drink. Because when we lost too much of fluid, तो saline भी तो चाहिए हो सकता है ना fluid. So through our intravenous, through IV देके saline भी चाहिए होगा. That will be prescribed by the doctor. So these cases are exceptional. And fever leading to dehydration. Dehydration का मतलब क्या है? Dehydration.
Lack of water.
Okay, very good. Okay, when we have insufficient amount of, when there is intake of when there is not enough intake of water in our body, that time what happen is that we suffer from a condition which is known as dehydration. तो किसी का dehydration होने से बहुत ज्यादा fluid पीने को बोलते हैं. For example, diarrhea हुआ तो dehydration होने का बहुत chances होता है. So we call the dehydration as the symptoms of diarrhea. तो diarrhea होने से dehydration होने का chances है. And in case of heat exhaustions or heat stroke, when the person remain conscious. So agar heat exhaustions. So heat exhaustion, you have any idea what is heat exhaustion? Yeah, I think you will know all these are very, very common. You know what is heat exhaustion? Heat exhaustion.
Weakness or
हीट एग्जॉस्शन का मतलब क्या है? आज बहुत ज्यादा सनी है, बाहर पे गया, या फिर you went for trekking and then like you were exposed to so much of heat. Okay, at that time what happened is that you might have a symptoms of like heavy sweating, your pulse will be rapid. Okay, then your body will be overheating. In this condition is also exceptional, that food या फिर drinks नहीं देना. All this we can't we can't say in this condition. So are you clear? Number 7 point. What are the exceptional one and what you don't need to perform? Are you clear?
yes, ma'am.
Jivan, please take attendance. Okay, only 4 minutes left. So are you clear whatever we have discussed today?
Yes, ma'am.
Okay.
Yes, ma'am.
You want to ask any questions? Because only 3 minutes left. With this, we will end today's class. And again, in afternoon, I have class now, so I'll be taking this one, practical on physiology. You are clear, right, all of you?
Yes, ma'am.
Yes, ma'am.
Okay, you write it down. Okay, as soon as the class is over, I will be directly sending you all the notes, the PDF of this, the remaining part, that is what to do, because till the symptoms I have already sent you all. So okay, so Jivan, are you done? Jivan, are you done? Okay, Jiban, are you done?
Done, ma'am.
Okay, then that's all for today morning class. Okay, thank you everyone. Have a nice day.
Thank you,
Thank you,
ma'am.
ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.